There's a lot of challenges, I would say, but I'm going to highlight three of them. First is having a vision. So a lot of us have a vision when we start off on a digital transformation journey, but the challenge occurs when funding starts to rain down, say from Ontario Health, and then you've got that new fancy money object that you want to run after. At that time, it's important to figure out when do you actually say yes and when do you say no. Saying no to the money is the hardest part. And that's where a good governance committee or a good governance structure within your organization can play a pivotal role, because you need to think about change management, your operational capability, your HHR resources, and try to figure out, can you pivot or do you stick to the vision you have and start to say no to a number of things. The other thing I would talk about is health equity. So we can't start off in this day and age on a digital transformation journey without thinking through health equity. But the first thing with health equity is getting that health equity data. And that therein lies a challenge. It's not as simple as asking the question about your race-based data or whatever you have and think about, I can just train my registration staff and we're good. What do you do when that patient asks you, why do you want this data? What are you going to do with that data? And that patient is not looking for answers like, oh, I'm going to actually look at your data and figure out analytics and try to figure out what I'm going to do with that. They want to know, what are you going to do with that data at this point in time as I'm going through my patient journey at this moment? So we have to be careful in making sure we have organizational capabilities to ensure we're providing culturally safe care as needed. As an example, at Niagara Health, we have a fantastic Indigenous health team. And they're able to provide services such as smudging or end-of-life care or whatever our Indigenous people need as they go through that journey. So when we get asked, why are you asking me that question? The answer we give is so that we can provide you Indigenous culturally safe care as you request it. That's not to say that we can't look at low-hanging fruit. So for example, we can always look at, when we look at remote care monitoring as an example, we can always look at vendors who provide Wi-Fi enabled devices. So people who are not financially strong can still access remote care monitoring. We can work with libraries or public avenues to make sure people have access to computers for virtual consults, as an example, if they don't have access to computers. There's some low-hanging fruits. And the last thing I would say is sustainability. When we go through the digital transformation journey or create that vision, making sure that we're looking at it from a sustainability perspective and not just stay in the land of pilots. So thinking through the funding of it, your operational capacity, the people required to sustain whatever you've put into place. So I think those three things are really important when looking through digital transformation. So when looking at digital tools, I would say the first thing we should ask is, what is the problem you want to solve? Why get a tool to solve a problem you didn't know you had? Why not flip it around and figure out, what is the problem I want to solve and what functionality or requirements are going to help me fix that problem? And once you know that, then follow the proper procurement route. And doing that, you will not only get the best tool that meets your needs, but also ensure you get value for money. The second thing I will say, it's about making sure that you're eliminating or reducing redundancy in your organization. If you have a tool that does X and does Y and does it well, why would you get a tool that does X and integrate it with a tool that does Y? It increases administrative or operational overhead. It's more expensive. We run into this problem all the time when we're implementing health information systems. You get this multi-million-dollar health information system, which can do a lot of the things that program-specific systems do. So when you start to decommission them, it's because you're reducing the redundancy, because you have this one system which will do what the older systems did. So it's important to think through that and make sure we're increasing our operational efficiencies. And last thing is interoperability. Whenever you're looking at digital tools, we don't work in a silo anymore. It's always making sure that we are connecting with other organizations, because our patients are going to be traveling through that continuum of care. So whatever tool we get is interoperable with other organizations within your OHT. Healthcare is very data rich, but there's very few healthcare organizations that have matured their analytic capabilities to make sure you get value out of that data. As the volume of the data increases, I think it's so critical to have an information and data governance structures so that you can then make sure you're managing data based on your organization's policies, procedures, and practices, and that you're in line with the legislative requirements for use and disclosure of personal health information. The other beauty of having an information data governance structure is that you will make sure that you're getting good quality data and accurate data and clean data. Because without that, you can't get accuracy of reports and you can't use the data to train machine learning. As the old saying goes, garbage in, garbage out. So from a cybersecurity standpoint, I think there's power in numbers as well as in sharing of information. I'm a strong believer that we need to band together against the bad guys while securing our house, so to speak. At Niagara Health, we've made significant investments in our cybersecurity program, and that's thanks to our board and executive team who are strong believers in cybersecurity and make sure that we have the investments for it. In healthcare, investment in IT, let alone cybersecurity, is an afterthought. So when we have a board and an executive team that is so informed and so well behind this program, it just makes the house that much stronger. Ontario Health has done a fantastic job in implementing RSOCs and local delivery groups, of which we are one. That's where the power in numbers comes into play. People who are more mature in their cybersecurity stance can help organizations that are not as mature and for earlier on in their journey to help bolster their cybersecurity programs. And there's also economies of scale. We can go to market in numbers and get discounts on the infrastructure that we need to implement. And the last thing is about sharing of information, which in healthcare we're not so good at. When there's breaches, we tend to get very quiet. We don't want to talk about the vulnerabilities. But in our banking industry, our counterparts, they get together, they talk about it, and they get stronger. And I think that's a lesson we in healthcare need to learn from them. When there is a vulnerability, let's talk about it so that the rest of us can patch those vulnerabilities and get stronger together. For learning and for networking. It's great to hear what other people are doing, and usually most people are grappling with the same issues that we are grappling with. It's great to hear what other people are doing, what has worked and what has not worked. It's so much easier to learn from other people's scars and get your own.